Bismillahirrahmanirrahim. So today we are going to study about the urinary tract infections. As we have already discussed that the Escherichia coli is the main cause of intestinal tract infections and urinary tract infections and many other systemic infections. So today we are going to study about the urinary tract infections. We have already discussed the intestinal tract infection in the form of watery diarrhea and the bloody diarrhea and the associated strains like enterohemorrhagic, enteroinvasive and the enterotoxigenic strains which cause these kinds of diarrhea in the previous lectures. So kindly watch the lectures of Escherichia coli, the first two lectures of Escherichia coli regarding the introduction, the epidemiology, the antigens, the intestinal tract infections. So today we are going to study about the urinary tract infections. So the strain which cause this urinary tract infection, it is known as the uropathic strain of Escherichia coli. How this uropathic strain of Escherichia coli? We have already discussed three other strains. This is the fourth strain. The first one is the enterotoxigenic. The second one is the enteroinvasive, which cause the bloody diarrhea. And the third one is enterohemorrhagic strain of Escherichia coli. And this is the fourth strain, uropathic strain of Escherichia coli, which cause the urinary tract infection. How does it cause the urinary tract infection? What is the pathogenesis? So this strain of Escherichia coli consists of pili. For example, this is the uropathic strain of Escherichia coli. So this strain consists of pili, and this pili consists of adhesion proteins like the P. pimbria and the pyelonephritis associated pili. These pili consist of adhesion proteins, and this adhesion protein are in the form of P. pimbria or pyelonephritis associated pili. This bacteria, uropathic strain of Escherichia coli, then binds to the epithelium of the urinary tract through these adhesion protein. They bind to the epithelium of the urinary tract through these adhesion proteins and cause the UTI. And this UTI may be limited to the urinary bladder. This UTI may be related to the urinary bladder, and this is known as cystitis. Or it can reach up to the kidney to cause the pyelonephritis. So this UTI may be in the form of cystitis when the uropathic strain of Escherichia coli is limited to the epithelium of the urinary bladder, or it may reach the kidney to cause the pyelonephritis. Now this cystitis can be characterized by the symptoms like dysuria, pain during urination, and the increased frequency of urination. And this pyelonephritis can be characterized by the symptoms like fever, pain, costovertebral angle tenderness, and also by the dysuria. So these are some signs and symptoms of the cystitis and pyelonephritis caused by the uropathic strain of Escherichia coli. Now the important point regarding the treatment or the prevention of Escherichia coli is that the cranberry juice can prevent the attachment of uropathic strain of Escherichia coli to the receptors present in the epithelium of urinary tract infection. Thus, cranberry juice can be used to prevent the infection caused by the enteropathic strain of Escherichia coli. And the people at risk of getting this UTI are hospitalized patients with catheters, etc., hospitalized patient in women. In women, because they have a small or very short urethra, and it is much more near to the anal canal. They have a small urethra and much more near to the anal canal, so they are much more prone to get the UTI caused by uropathic strain of Escherichia coli. Now we will study about the systemic infections. Systemic infections caused by the Escherichia coli. So these systemic infections can be in the form of sepsis, or it can also cause the neonatal meningitis, when it enters the systemic circulation, or it can also cause peritonitis along with other bacteria like the bacteroides and other anaerobes. So how does it causes the sepsis? What is the mechanism or pathogenesis behind and the endotoxin or the antigen involved in the occurrence of sepsis? So the main antigen which cause the sepsis is the cell wall O antigen, which is also known as the endotoxin. Cell wall O antigen, which is a somatic antigen, and this is the endotoxin. And this, when this endotoxin enters the systemic circulation, we have studied already in the general bacteriology that this endotoxin cause the sepsis, and it is characterized by the symptoms like fever, hypotension, and the disseminated intravascular coagulation. So these are some symptoms in which occurs in the sepsis, and it is caused by the cell wall O antigen of the Escherichia coli. How this neonatal meningitis occur? So the most important pathogen or the most important antigen which cause the neonatal meningitis, it is known as the capsular polysaccharide, also called as K1 antigen. And how does they do this? This capsular polysaccharide, it is antiphagocytic. It wound around the bacteria and prevent the binding of phagocytes to the Escherichia coli, and thus prevents its killing, and thus cause the neonatal meningitis in the neonates. And it is the second most common cause of neonatal meningitis. Neonatal meningitis after that caused by the group B streptococci. Group B streptococci is the first most common cause of neonatal meningitis, and this Escherichia coli is the second most common cause of Escherichia coli in the neonates. Now coming towards the peritonitis. So the Escherichia coli can also cause peritonitis along with the other anaerobe bacteria like the bacteroides, Fusobacterium, etc., and it can cause the peritonitis, i.e. inflammation of the peritoneal cavity. So that's all for today. We have studied about the urinary tract infection caused by the Escherichia coli and the systemic infections in the form of sepsis, neonatal meningitis, and the peritonitis caused by the Escherichia coli. In the next lecture, we will study about the lab diagnosis, that how do we diagnose the Escherichia coli in the lab. So kindly stay tuned. Thank you. Jazakallah.